Hey.
Thanks for coming to the party.
Hi, I wouldn't have missed it. It's been forever since we've seen each other. How you been?
I'm all right.
Is something wrong?
I'm fine. But my doctor said I should do something called genetic counseling because women in my family get breast cancer and ovarian cancer. I'm not going. I already know that cancer runs in my family and that I'm probably going to get it someday, so what's the point? I get my mammogram every year. What else can I do?
Breast cancer runs in our family too. My doctor told me the same thing and I didn't want to go either. I was scared to hear what they had to say about it, but I went anyway.
Girl, I never even heard of genetic counseling. What happened when you went?
Well,
What am I doing here? I'd rather not know anything about this. No news is good news, right? I should have had someone to come with me, but I don't want my family to worry about me. As a matter of fact, I don't want them in my business anyway.
You may be wondering what happens at a genetic counseling appointment. It's really just a conversation with someone who's an expert in helping you understand how conditions like cancer can run in families. They'll ask questions to learn more about your family's experience with cancer and to figure out how that relates to your chance of getting breast cancer in the future. Most importantly, you'll get information that will give you the power to make the best decisions for your health. Genetic counseling does not tell you that you have cancer, and it doesn't tell you that you'll definitely get it someday. Think about it this way. Cancer's like the weather. There's always a chance it will rain, but the chance is higher on some days than others. And all women have a chance of getting breast cancer, but some women's chances are higher than others. Genetic counseling is like watching the weather report. You watch it so you can make the best decisions for the future. Like deciding whether to have a house party or a backyard barbecue for your cousin Felicia's birthday party.
Girl, don't you ever watch the weather report?
The information you get from genetic counseling will help you and your family find the best ways to protect yourselves from cancer. Some days, the chance of rain is higher than average. And you might want to take extra precautions. That might be overdoing it. If the genetic counselor finds that your chance of getting breast cancer is higher than other women because of cancer in your family, they might suggest that you talk to your doctor about starting mammograms at a younger age than most other women. They may talk to you about a new way of taking pictures of the breast called a breast MRI scan that can detect cancer even when it's too small to see on a mammogram, which means you have the best chance of being cured if a cancer ever develops. The counselor will also talk to you about simple things that everyone can do to lower their chance of getting breast cancer, like eating healthy and staying active. They might even talk to you about medicines your doctor can prescribe that can prevent breast cancer from developing in the first place. When the chance of rain is really high, special steps can be life-saving. Sometimes the genetic counselor recommends a test that can be done on blood or saliva, called genetic testing. Genetic testing doesn't tell you that you have cancer or that you'll definitely get it in the future. Think of genetic testing as one part of a very accurate weather forecast. For some people, it provides the most accurate information to help them and their family choose the best ways to protect themselves against breast and ovarian cancer. Remember, genetic counseling is just talking. You don't even have to put on a hospital gown. You just tell your family's story and learn information that will help everyone in the family make decisions that are right for them.
Because I did not want to come in here.
I understand. Now let's talk about you.
I felt relieved after genetic counseling. I always thought it was just a matter of time before I'm the one with breast cancer. But that's not true. My chances are higher than other women, but there is something I can do about it. I told everyone in my family about it.
Is it expensive? Because I probably can't even afford it.
Actually, most insurance plans cover genetic counseling. But even if you don't have health insurance, the genetic counselor can often help you find ways to get the counseling. You just have to call.
Go on and make the call. I know you're not afraid to make a call. You're always on your phone.
Okay, very funny.
Girl, make the call and make an appointment while you're at it.
All right, I'm going to make some plates. You want something?
No,
I
I'm
do.
fine.
I do. I'll be back.
Take the time to learn how your family's story was affected by cancer and tell the rest of your family what you learned. Don't let cancer be the family secret. And if you have breast or ovarian cancer in your family, talk to your doctor to find out if genetic counseling can help you and the people you love learn how to protect themselves. Or just call a genetic counselor. You don't need a doctor's order for a phone call. Remember, knowledge is power. To find a genetic counselor near you, or to learn more about genetic counseling, genetic testing, and ways you can protect yourself from breast and ovarian cancer, talk to your doctor or visit these websites.